Gardens. And we're all very excited to be going.
We're on our way.
Yeah, we're all here today. There's 4 of us come down for the AGM. We have 2 newbies here who've never been to an AGM before.
This is my 29th one.
We're going to see the Minister in a couple of days' time, which will be really interesting to see what she's got to say for herself after all the rubbish she's been coming out with.
Love it. Finding out what our next step is in our campaign.
What do you want? Ratios! What do you want? Safe patient care! What do you want? Ratios! What do you want? Safe patient care!
I'm a new one to this because of this first conference I've come to.
Welcome, delegates, life members and guests.
This annual event, of course, is very important in terms of encouraging us to explore the current debates in healthcare and provide an opportunity to explore the future directions for nursing and midwifery.
And do a bit of networking and get ideas of what other sites are planning with our future industrial actions and give us some ideas to take back to our branch.
Well, so far this morning we've heard from 2 fabulous speakers.
Nurses could play a very strong balancing role in moving towards the kind of health system that would be more just and more equitable.
She was really informative. It was so nice to hear a history about where nursing's come in the past, and it was really good to see that because that way we can see where it's going to go in the future and what's really happened politically and how that really needs to change for us to move forward.
She was one of the documentary subjects of Michael Moore's 2007 movie Sicko.
And money can be made on all sorts of commodities. I have nothing against profits, but let's not make it on human health. And Australia, help us make sure that happens.
As I look around and I look at your posters and I see put the patient safety first, I know I'm in the right room. Well, I put it to you that all we can do is be responsible for the choices we make. The choices we make will be our history tomorrow. And wouldn't it be fantastic if we were proud of our history tomorrow?
It all makes a difference to what you can do as nurses. There are so many of you in the room. No one can doubt the passion of nurses. No one can doubt their passion for quality and safety outcomes, for good care.
The speakers on Education Day were brilliant.
Yeah, very good. Get out of bed and just, you want to be great.
Nurses aren't just the people who do all the dirty jobs, but we really do make the difference at the end of the day.
But I hope when times are tough or your fight looks too hard, you're going to remember this and it might help you to get through.
It's lovely to be here among friends. I love nothing better than to come back to the nurses where I always feel at home.
Well, really, I'm just looking forward to learning more because I feel that there's so many things that we don't know and every new thing just ignites new passions for things, I think.
It's been excellent. It's been an eye-opener for us all again.
It's been a brilliant conference, absolutely brilliant, very well organised. The highlight, I think everyone's enjoying the train.
Yeah. Are you looking forward to the dinner on Thursday night?
Oh, definitely. We have an outfit planned. Yes, we do. We've been working hard on it as a South Coast table. You won't be able to miss us, that's for sure.
And we're all really looking forward to seeing Mrs. Skinner come to talk to us.
I think we've got to pin her down and try and get some answers because, as we know, they're very good at evasion and we need some concrete answers.
That'll be a very interesting scenario.
It should be a fiery meeting, yes.
Thanks very much, Minister, for coming along today and announcing the initiatives that you have provided to us and for being brave to stand up and answer the questions from our delegates.
I hold nurses in very high regard and I commend your vital contribution to improving the quality of patient care.
Why won't you, Minister, agree to support guaranteed award-based staffing levels for emergency departments? This will go a long way in improving patient outcomes and safe patient care.
I've acknowledged that there is an inadequacy in some cases in some of the rural areas.
When will you and your government negotiate in good faith with the Nurses and Midwives Association of New South Wales around cementing the ratios that have already been won and extending those ratios across the state and providing equity of ratios?
So I'm sorry, I just won't buy that you're not getting a safe, service if you go to a country hospital. I just don't buy it.
If you're a post-op patient in Scone, you're on the ward, there are 2 nurses looking after you. A patient comes into the emergency department and has a cardiac arrest. Both of those nurses are needed in that emergency room. So there is no nurse looking after the patients on the ward. How can you deem that to be safe?
I'm sorry, we'll have to agree to disagree on that.
In the Northern Sydney Local Health District, we actually have the highest percentage of private beds in the whole of the state. The last thing we need on the Northern Beaches is more private beds.
There is no doubt your expression of interest is for a Northern Beaches hospital to be designed, built and operated by the private sector to deliver some public services to the people in Northern Beaches. We welcome every single additional nurse into the public health system. We want them to be able to stay in the future. That is what drives us, Minister.
And we're going to take that back to our local members and still continue the fight.
Yeah, I think she's a very brave woman to come and face up to us.
I'm sure she'll walk away from here on Friday with a very clear message.
Safe patient care!